Today we're going to learn about the whole research process and what's going on in my colleague Dr. Rob Schlauch's lab, the Addiction Research and Treatment Lab. He's going to talk to us. Shall we advance the slide? Enhancing education through collaborative research. And Dr. Schlauch is going to give an overview of what goes on in his lab, and then he's going to invite a lot of his folks in his lab who include undergraduates, postbacks, students who've already graduated, some graduate students, to talk about how they're involved in the lab. We hope you will have a lot of questions for them because we want this to be interactive. So I guess I'll stop talking and let Dr. Schlauch take over. Please welcome him.
I never use mics when I teach, so this is going to probably be really loud. So I apologize. So, well, thank you for being here. When Dr. Bryant approached me about doing this talk, I really thought for quite some time what to actually present. Do I present my research? Do I present our research findings? Do I talk about the studies in detail? And at the end of the day, I didn't think that would be all that useful for everyone here. I want this to be something that is useful, and hopefully you walk away from this knowing how you can get involved in research rather than what is the research being conducted. So the whole kind of purpose of this is to really get involvement from you and talk with you all about the research process. How can you get involved? Where are the benefits of doing that? How does it enhance your education? How does it provide other benefits if you plan on going to grad school? And then I'll give you some examples through our work and the types of studies we do and how students are involved. And then we want to really have this more panel-like discussion. We really want to hear from you and what do you want to know about the research process as an undergrad? How could you get involved? So this is really kind of what I envision this to be. So really, I'm just going to give a quick overview of how collaborative research can enhance education. What are some of the other benefits of collaborative research? And then examples from our lab. And then we're going to open it up for a discussion where grad students, undergrads, and postbacks from my lab will come up here and basically talk with you all. I use the term collaborative research deliberately. I don't really like the term undergraduate research assistant, even though that's what people are when they work in labs. But collaborative research really reflects the idea that when undergrads are working with us in our lab, it's not just doing what we tell them to do. It's not just a job. It is very much a collaborative process. And I cannot tell you how many times in that process where we're talking with undergrads working in our lab, we're getting ready to design a study to look at drinking in college students, and we look to them for their anecdotal experiences and examples to help inform our research designs. So it is very much a collaborative process, and that's why I really want to focus on collaborative research and how you can be involved in that process. So I'm actually going to start with a question to you all. How can this collaborative research enhance your education? What do you guys think? Yeah. Okay. So you can apply what you learn in all those classes you take. Sure. Say that one more time. Yep. So it's a real world application of the things you've learned. Absolutely. What else do you all think? Go for it. It's fun. It can be, especially in some of the research we do where we actually give alcohol to people. Yeah. Mm-hmm. Mm-hmm. So you're getting other perspectives to get a bigger pool of knowledge. Absolutely. Yeah. Hmm. Yeah. So networking is definitely going to be part of that as well, and meeting other people that you may not have had the opportunity to interact with before. Absolutely. So these are all great answers. And yes, it is really about taking the theory that you're learning about and putting it into practice. You get the opportunity to participate in all phases of research, starting with even problem conceptualization, right? Starting with, okay, I observed this the other day. Now I'm curious about it. Where do we go from there? Right? A lot of times our research questions comes from us just observing others' behaviors. And then we go look in the literature, what theories are out there, what are potential questions we can ask. We develop a hypothesis. Then we moved into how do we design a research study to answer that question. Then we collect that data. Then we analyze that data and eventually write it up and disseminate those findings. You can be part of every element of that process if you work in these labs. Okay, so we'll talk about that when we get to some examples in a little bit. You gain experience actually utilizing the skills you learn about. How many people took research methods already? How many people get goosebumps when they hear the word research methods? Right? Okay. Right? But this actually allows you to see it in action, right? How do you actually implement an experimental design? How do you implement a correlational or survey design? The dirty word statistics, right? But you get practice in doing these things. You actually see it in real life. How does it actually work? It's no longer just something on the page that you read about or something that you heard in a lecture. You actually get to experience using those skills. Engage more deeply in a topic that may interest you. I can't tell you the breadth of research that occurs in our department. We have three primary areas: clinical psychology, we have the cognitive neuroscience and social area, and we also have industrial organizational psychology. If there's a topic in psychology that when you took intro that was like, oh, that's interesting, I can almost guarantee somebody here does research in that area. And you can get more in depth on that area. So it's another good way of just kind of enhancing those topics. Opportunities to develop your own research questions. This one may never have come across your mind. Like, well, if I get involved in a lab, am I actually allowed to do my own research? And the answer is yes. If you have a research idea, talk about it. And in fact, a couple of people that will be coming up here later, a couple of undergrads have ongoing research projects currently using data that we have in the lab. So it allows you to really kind of get into that process even more detail. Other benefits, as people were mentioning, one, you get to hone the skills that many employers seek, right? So even if you don't go into a field that directly is referencing psychology, those skills that you develop are translatable, right? And this can include working in teams, right? When you work in research labs, it is about teamwork, right? And in some places, you're able to sort of advance and become sort of a team leader and a project coordinator where you're managing other people. These are valuable skills that you can then translate to once, wherever you go after you graduate. Critically thinking about material, right? That's what we do in research. We always question things. So you get practice doing that. Working with different software packages and learning the ins and outs of all those things. Analyzing, interpreting data. Organizational skills, multitasking. These are all skills you get to apply that then you can put on a resume and highlight when you're seeking employment later on. So it also provides those benefits. In a lab like mine, it also allows for the opportunity of working with clinical populations. A lot of our research, and I would say about 50% of our research, recruit individuals with an alcohol use disorder. And you, as part of your responsibilities in a lab as an undergrad, you are often interacting with those populations, whether doing assessments, making phone contact, phone screenings. There are a lot of opportunities to kind of get experience and hear the stories from individuals, which then can inform your own research questions or help you decide what maybe you want to do moving forward. So you get that interaction that is often missing just in normal of taking classes, right? Uh, Developing mentoring relationships with faculty and graduate students. This is a good opportunity to have more one-on-one time with individuals, get to get more intensive mentoring in terms of, all right, if I want to apply to grad school, what things do I need to do? It helps with getting letters of recommendation, helps with networking, right? Networking is a big thing. Meeting people that you wouldn't ordinarily meet working in labs actually opens those doors, okay? This one is always a good one. Paid positions after graduating or maybe before you graduate, depending on the lab. Sometimes the labs have paid positions as project coordinators, right? And this helps sometimes for that gap year, right? You graduate, you're not quite sure what you want to do. Now you've developed this network of people. These paid positions come up, it opens that door. And now you could take a year or two to figure out, all right, what kind of graduate training do I want to seek? Or if you're just thinking about grad school, for example, or what do I want to do with my degree? So it's just a good opportunity that people often continue with after they start their work in labs. Are there other benefits that you guys can think of? Those are just the ones I came up with. What other benefits can you guys think of? Do you guys have any examples? Did I hit them all? Very much? All right, well, that's good. Okay. So what do we do? So now transitioning a little bit, how do we take all that stuff we talked about and apply it in our lab? So our lab is the Addiction Research and Treatment Lab. We are broadly interested in the etiology and treatment of substance use disorders with a primary focus on alcohol. We do research with other substances such as marijuana, nicotine, but it is primarily alcohol, okay? And to get a little bit more detailed of what we do, and don't worry if this seems a little confusing because I'll give you some applied questions that we actually ask, but we use a multidisciplinary approach to study several different facets within alcohol use disorders. One being craving in the context of alcohol use disorder treatment and recovery. Okay. Another being what are the processes associated with positive treatment outcomes? And this includes things like pre-treatment change. This is one fact that actually surprises a lot of people. Whenever we bring people in for a clinical trial for treatment, 50% of them stop their drinking before they had the first treatment session. So what does that mean for our treatment? If they've already stopped, what does that mean for treatment? What's the role of treatment? It's obviously not causing the change in drinking behavior, but maybe it helps maintain the change, right? And those are questions that we have to ask ourselves. What does it mean to be recovered, right? So that's a really multi-faceted. You can come on in. Go ahead. You're good. Right. And then finally, we also do risk factors for the development of AUD and risky drinking. So it kind of goes the whole gamut from how to sort of escalate your drinking into problems and how do you get out of those problems. Okay, so our lab is pretty broad and we do this from a multidisciplinary approach. And that basically means we integrate theories across multiple disciplines. Within psychology, we use social psychology theories, we use cognitive psychology theories, we use information from biopsychology to better inform our research questions and then test those mechanisms. So here are some concrete examples of what we do. We will ask the question, how do people change problematic use? Right? How do they change? Right? What does it mean to be recovered? Historically, recovery was often narrowly defined as not drinking and abstinence. And that is driven by long-standing history with probably the most accessible treatment option for people with alcohol use disorders. Do people know what that is? What would be the most accessible treatment option that's available to anybody? AA, which is a fantastic treatment. It's empirically supported. But in their history, abstinence is the sort of only outcome. What research actually tells us is that's not the only outcome, okay? People can actually have positive outcomes and high levels of functioning with moderated drinking, okay? So we look at this, like how do you best define what does it mean to be recovered? We also look at what is important for initiating versus maintaining change. This has been a very neglected area within the AUD treatment literature. All we've been concerned with is how do we change people? How do we get them to change? How do we initiate that change? Less attention has been looked at in terms of, well, once that person has changed, how do they maintain that? And those processes, those factors may be extremely different. What is really effective to make that change may have nothing to do with how they maintain the change. So we have to better distinguish between initiating versus maintaining. Other questions? What increases the risk of problematic drinking? Right? There are many, many different factors we can talk about and many different factors we've looked at in our research lab, and I'll give you some examples of those projects in a minute. And then a lot of our research early on, and still to this day, but not as much, has focused on what is craving, right? Craving is one of these constructs or variables in the addiction world that nobody quite knows what it is. I see Dr. Darkus back there hiding. He's been in the AUD literature for how many years? How many years have you been doing this? What is craving, Jack? You don't know, right? But that's the problem. What is it? What does it mean to crave something? Most sort of layperson definitions is the desire for something, right? A strong desire for alcohol. Well, that's not very predictive of actual drinking. So that's what my lab focuses on. How do we better define craving as more of a multidimensional process and better measure it? Okay. And we do this using tons of methodologies. We implement experimental designs, and as part of that, I have done alcohol dosing studies where basically we randomize people to either receive alcohol or not receive alcohol, and then have them perform tasks in the lab. We've done it using correlational and survey methods. One type of correlation survey method is what we call ecological momentary assessment, or EMA. This is when you measure things you're interested in real time by pinging people's cell phones as they're going through their day to fill out questionnaires. Okay, so we would do that multiple times a day to try to understand how things are unfolding in their everyday lives. Clinical trial methodology. So if we're interested in treatment outcomes, and one of our big studies right now is running a clinical trial where we recruit people interested in treatment, give them a dose of treatment, and then follow them for anywhere between 24 and 54 months post-treatment to understand recovery. So we use those methodologies. And we're beginning to bring in more psychophysiology in collaboration with Dr. Clayson's lab here at USF. We're going to begin some projects where we use multi-method assessments of things we're interested in, such as emotional processing and getting brain electrophysiology to basically understand the process at a more automated level, right? And does this incrementally predict above and beyond somebody's self-report? So we're starting to integrate some of those methodologies as well. So I'm not going to spend too much time here because I'm already going a little longer than I want, but this is just a list of the different types of projects that are either recently completed or currently ongoing in our lab. As I mentioned, we have this big R1 right now that's ongoing. It's the clinical course of alcohol use disorders. So understanding recovery. This is a massive project where we're going to get over 13,000 assessments across the 5 years among 250 participants to try to get at that dynamic relationship of like how things are unfolding in a more real-time fashion, okay? We are looking at things such as optimal well-being, right? Alcohol use disorder and substance use disorders have a lot of stigma around them. And how many people have heard the saying, once an addict, always an addict? Right? Well, this kind of challenges that notion because we're looking at, well, once somebody has recovered, how well are they doing? And there's going to be a certain percentage of that population that is flourishing. So we're starting to demonstrate that. And you can see on there the types of experimental studies and other EMA type studies that we do. So where does this integrate with what are responsibilities of research assistants in our lab? Well, undergraduates often help us with database setup and data entry. Okay, it's a little boring of a task, I'll admit it, but incredibly important, right? Because we have to analyze the data afterwards. We have undergraduates helping us with phone screenings. Again, 50% of our studies often have to deal with community samples, and we're recruiting people with alcohol use disorders. So we do initial phone screenings, and you'll do initial phone interviewing with potential participants to see if they meet initial criteria. That also means you'll be communicating and contacting potential participants and helping with reminder calls, scheduling, things like that. We even have undergraduates conducting assessments in interview format. One of the ways we collect drinking data is using a method called the timeline followback, which is a retrospective reporting of drinking behavior. But it has to be done in interview format. So undergrads actually get trained how to do that, and we'll conduct timeline followbacks with some of our participants. Run study protocols, right? I can't tell you how much we're indebted to undergrads that work with us, because they are really on the ground kind of implementing a lot of this stuff and running study protocols, getting recruitment, informed consent, and actually conducting the study, including serving as confederates in our study. How many people remember that term, confederates? What is a confederate in a research design? Yeah. Mm-hmm. Mm-hmm. Yeah. Yeah, so it's somebody who's part of the research team acting as a participant, but we want to standardize it, right? We want those conditions to remain the same. So they are people who respond in certain ways and do certain things during the study that others think they're participants, but they're not, right? And to better understand. So we have studies that we've had people serve as confederates. So a study that is finished, we did a social stressor task to see how that impacted drinking behavior in the lab. And there was a confederate to create that social stressor. And then, of course, we debrief people and explain the purpose of it afterwards. But that's one of the ways to be involved in the research in our lab. Another is through poster presentations and participating in the write-up of manuscripts. Okay, so again, all the phases of research is open in our lab. Put this up real quick. There are plenty of undergraduate projects, so led by undergraduate research assistants in our lab. These are 3 that I've highlighted. The first 2 are ongoing. One's an honors thesis. One is just another project that has been presented at a national conference already. So we're in the process of writing that up. And the last one is something that we've already published with undergrads. And these were undergraduate led at the time. Okay. So lots of opportunities. This is just a list of current members. It's not an exhaustive list of alumni of the lab, but this is just a list of current members. And what I would like to do now is to bring up people from the lab. You guys can come up now. Okay. We got a lot of people here to ask you answer questions. Okay. So I'm going to have them they're going to sit up here, and I'm going to have them introduce themselves briefly. And then what I want this to be is more of a discussion. What do you guys want to know about undergraduate research and being involved in it? And use their experiences to help you understand that process and maybe even get involved in that process. So, wow, you guys actually broke into, wow, I figured you'd be like grouped together, grad students and then undergrads, but that's okay. It's fine. All right. Which side do you want to start? Doesn't matter. You're good. All right. All right, Alex, you want to start? Just introduce yourself, say what you're interested in, and then just keep it brief, and then we'll open it up.
Hi, everyone. I'm Alex Rivera. I'm a current 3rd-year student, and my research focuses broadly on sexual minority health and alcohol expectancies and behaviors.
Hi, everyone. I'm Agata. I'm a first year in Rob's lab. I'm interested in cognitive factors implicated in craving and also the use of like psychophysiology in understanding recovery. So like EEG methods.
Hi, everyone. My name is Gael. I'm a second year in the lab. My research mainly focuses on the link between emotions and alcohol use, so emotion regulation, emotion differentiation, and things like that.
Hi, my name is Charlie, and I'm a second year graduate student in the lab as well. And I'm starting up my master's project, which is going to look at sleep variability in the context of treatment for alcohol use disorder.
Hi, my name is Isabella, and I already graduated, and I'm a project manager at the lab.
Hey, I'm Samai. I'm a fourth year psychology major. I just started in the lab probably about a year ago, and I'm working on craving profiles and its relation to recovery and the AUD sample.
Hi, I'm Alex. I'm one of the program coordinators for the recovery study. I'm a fourth year majoring in psychology, and I'm interested in the cannabis craving relationship.
Hello, my name is Macy Rouse. I am a recent graduate and a program coordinator for the art lab here. Kind of in that exploratory phase, but interested in clinical psychophysiology.
Okay, you're gonna hold on to that mic and then you're gonna pass it around. So what we really want to do is make this more interactive and answer questions that you guys are interested in. It could be anything. It could be anything about our research. It could be about how to get involved. So hands already went up. So I don't know which one up first. I'm just gonna pick. I'll start here and then work my way back. Okay, go ahead. And I'm going to repeat the question so they can hear it if there's anybody on the stream. So how do you get into research labs? So Macy's ready to take that one.
I'll take this one. So I actually just got into research this spring, so I'm still new to it myself. I got in my senior year. My biggest advice for anyone wanting to get into research is to just ask faculty members that you like. Even if they can't help you get in, they might know someone. And like Dr. Rob said, it's a lot of that networking. You do not need to know much about research to start getting in. A lot of it is going to be asking questions and figuring it out as you go. Like, I think a big issue is like feeling like, oh, I can't do it because I don't know about it. Just ask and just kind of start doing it, and you'll learn as you go. You can, any faculty member that you're interested in researching, if you go on USF's website, you can look up the faculty list, their research interest, and just send an email, introduce yourself, tell them, hey, I'm interested in your work. I would love to talk more, and just kind of meet them, and you'll find who you fit with pretty quick.
Any other thoughts from the panel? Or does that sum it up pretty good?
I've had a numerous experiences in trying to reach out to different professors and everything. So what I would say in that email is not open up like, hey, I want a research opportunity. Like, this is what I want out of the whole thing. Like, just talk like from an interested person perspective, like, oh, I'm interested in this part of your research. Could we talk more about it? Could we have a meeting? And that's where that relationship can start to develop.
Conciseness is key when you send emails.
I think one underutilized resource too is us graduate students. There are a ton of different graduate student projects that aren't necessarily, I guess, as open or available like on the USF website. So, for example, if you're in a class and you're doing well in the class, and during your lab session, maybe you ask your TA if they have any projects or if there's any projects in their lab going on, and they can be also a very good resource for you as well.
The message is don't be afraid to ask. Right? Okay, I'm gonna go that way and then I'm gonna come back up. Oh, right, yep. Yep. Mhm. That's the goal. We're doing it now, yes. Yeah. Mhm. Yeah, I mean, I'm assuming this is gonna be for me to. So it's interesting because you'll get different types of research participants, right? And shame and guilt around substance use are really two emotional components that is a part of it for a lot of individuals who experience difficulty. And how that manifests in the behaviors that we see in research is going to be quite varied. We have participants that use that to motivate themselves to do these studies because they don't want others to fall into these paths, right? We have people that are doing it, obviously for personal reasons. So you do see it in terms of how long do they stay with us is one of your questions. It does vary. It does vary. Some research protocols, we were able to obtain about 85% retention rates. Currently in our study right now, we're struggling a little bit more. We're struggling a little bit more. So it does vary. And what's driving that? That's a great question. We don't have a good understanding of the factors of what keeps people in these programs. Treatment dropout in substance use just broadly is pretty high. And even if somebody does complete a round of treatment, relapse rates are about 60% within the first 3 months, right? So even though we think we know a lot about treatment, we still don't know a lot about treatment, if that makes sense. So does that kind of answer a little bit? Okay, cool. Yes, I don't remember. Yeah, go ahead. Mm-hmm. As somebody out with research or like an undergraduate research assistant. Mm-hmm. So that's definitely going to vary, and I'll let them talk a little bit about their experiences. And the question was, what do the hours look like as a research assistant, and what's the commitment to it? Thank you, Judy.
So I've had the luxury of being with the lab for about 2 years now, and I would say it really varies by the study. It depends what phase the study is in. If it's in the, they're still waiting to get it approved, kind of like still like trying to figure out how they want to kind of conduct the study versus whether the study's active and you're actively trying to recruit participants. I would say most of the time, in my experience, it's about 5 to 10 hours. And I would say you could really work it in with your schedule. And most of the time, the graduate students are really understanding and they can work with you and be flexible with your kind of schedule.
It's definitely flexible, right? You just set that expectation up front, right? And if you have a certain amount of hours you can work, you let people know that. And then if it's a good fit, then we move forward. If it's not at this time, then, right, just be upfront about it. Definitely. Yeah. And you had a second question. Yeah. Yeah. Okay. Yeah. So that's one of the big problems in the literature is that historically relapse is defined as return to use or any use in a lot of protocols. And in some protocols, it's return to problematic or heavy use. So it usually focuses on use only. And what we know in the literature is that use metrics are not a good indicator of treatment success. We actually know that at least 20% of people who are in recovery will still engage in heavy drinking pretty frequently, but have high levels of functioning. High levels of functioning, yet they're still drinking heavily. So that's one of the limitations of our research to date is not our research, but the fields is how they define what is a return to, what is a relapse, so to speak. So, yeah. And that's one of the things we're looking at in the current study in what we call NIAAA's new definition of recovery. So, okay, yeah. And then, say that again. Okay. What was that? Because you graduated, they've graduating, so they don't want to bring you on before you graduate, is what they're saying. So I'll turn it over to the grad students who. So the question, did you have a question? Do you want to know why that is or how you can, okay, so how you can work with that essentially. Okay, so if you're graduating and have a limited amount of time, how do you work with that to get involved?
I guess I'll take this one because I have several students who are postgraduate. I don't think it's necessarily a detractor if you are graduating, but what's more important is that one, you set the expectation of when you'll stop working. So most labs require at least a 2-semester or 1-year commitment. And so if you're saying, oh, I'm going to be graduating soon and I'll be leaving, then yeah, it takes, at least several months to train people. So it's difficult to get like 1 or 2 months of production, out of one semester. But if you're graduating and maybe you're sticking around or you're from around here and you're still available after graduation, that shouldn't necessarily be a problem. So I guess being upfront with those expectations and maybe just searching for a lab that's willing, I guess, to listen to those expectations is what's going to be important.
Okay, yeah. I'll come over here in a second. Yeah. Okay, so this is more of a research related question. How do we deal with individuals at different levels of severity? And how do we quantify that? Well, I might actually throw this to Alex Evenhouse. What's one of the things we do in our protocols?
So for the recovery study, during our intake process, we screen for clinical withdrawal. And so based on that cutoff, that doesn't make the person ineligible for our study. We're interested in AUD for the recovery study based on all severities, but we want to make sure that the people in our study aren't going to put themselves at risk for abstaining from alcohol. So typically, if they do need detox, we'll kind of give them a list of resources and then ask them to come back after they complete detox. But we really want to help everybody who's kind of struggling with having an alcohol use disorder. And so we try to incentivize people to come in at different levels of severity.
Yeah. Having the varied levels of severity is important for research. You don't want your sample to all look the same because then how do you generalize it to the whole population of interest? So we put in a lot of safeguards in terms of keeping participants safe as they're participating through research protocols. So if they come in and they have a real severe level of alcohol use disorder where they're showing a lot of withdrawal symptoms, and this is a fact that a lot of people don't know. What's more dangerous, opiate withdrawal or alcohol withdrawal? Alcohol withdrawal. It can kill you. Opiate withdrawal is the worst form of like the flu you'll ever experience, but alcohol withdrawal can actually lead to death due to seizures if it's really severe. So we screen for that, and then we try to get them the appropriate resources while they're still participating in our study. Yeah. Okay. Yes. Hi, Tamara. Mm-hmm. Okay. Let me start with the first one. Can you hold the second one? Yeah. So the first question is, how do we decide what methods to use in our study and what measurements do we select for our studies? Does the panel want to go with that one? Grad students in particular?
That's a very good question. I think it's kind of a twofold process. So one, you have to ask yourself, what is the question that we're asking? And typically based on the type of question that you're asking, it may lead you in a direction towards the methodology you want to use. But when you're researching that question and where you want to go with that question, you're going to observe different studies that have different methodologies. And so you draw upon basically the research that's already been done to help you develop your own methodology. Usually, I like to say in research, we don't usually, we're not recreating the wheel a lot of the time. We're drawing upon inspiration from other studies because it's responsible to see what's already worked and see what is considered, I guess, a valid form of methodology before we just go in and do the research. I don't know if that answers your question, but.
I mean, it really comes down to what is valid and reliable in terms of getting the measurement of what we want. So the EEG stuff, there's been a lot of work done in some of the constructs or the factors we're interested in. So that's why we're integrating EEG, and we have the expertise here. So that's going to also drive it. What collaborations do you have? Who has what expertise will also drive some of the choices you make, I think, as well. So second question. Oh,
Yeah.
I'm sorry.
Yeah,
I'm sorry, Gael.
You're good. I was just gonna say too, like, I agree with what Alex said, and like deciding between doing an EMA study versus like an experimental study really depends on not just the variables you're interested in, but also like what mechanism you're interested in. So like I'm currently developing my thesis, and like I'm interested in the effect that your ability to differentiate emotions has on your alcohol consumption, but I'm not interested in it in the moment, like having someone come into the bar lab and like just studying that like just in the moment. So I'm more interested in like the average of someone over like a 2-3 week period kind of thing, or like the fluctuations between their ability to differentiate over like that period. So an EMA study would make the most sense for what I'm interested in terms of like what type of effect you're looking for. So I would say that's also something to consider.
Everything we do in terms of research methodology is driven by theory and the question. You don't pick methodology to come up with a question. You come up with a question and then pick the methodology. So that's really what it comes down to. And Gael mentioned something that I didn't really highlight. Let me just do, I'll get it ready as we start with the next question. What's the next question? Mm-hmm. Mm-hmm. So how do we basically work in collaboration, essentially? Okay. Well, you guys have a lot of collaborative experiences right now. So you want, and then I'll
I
answer.
guess I can. Yeah. I don't know if I've done this necessarily here as much, but definitely in my prior work at UC Irvine, we were a or an interdisciplinary team that worked with the computer science and information departments in the field of psychology. And it is very difficult a lot of the times because a lot of the ideas and concepts that you take for granted being in the field that you've been in for, most of your life, other people don't understand it as much. And so it's really, I guess, getting to this point where you're comfortable enough with sharing information with individuals, and that starts by growing relationships, by being curious, by coming to people humble with your idea and asking them as experts, what do you believe about this topic, or what do you know about this topic, and how can we help? So I think it really starts with the genesis of the research question and having in mind that you're going to need help from other individuals, and going into, I guess, starting that relationship humble and asking questions and really just being open to accepting new information. And, over time, you start to learn each other's lingo and terminologies and things. But really, it's just, being open-minded and being willing to learn about other individuals' experiences. I think that is probably the most important part with working in an interdisciplinary team.
And like full disclosure, I don't have as much experience with collaborative research, so this is just kind of how I've seen it so far in the labs. But I do think there's a sense as well of you finding someone to collaborate with where your kind of primary future plans line up. So kind of the perspectives, they may be looking at it from this perspective and trying to go to this end goal, and you're looking at it this perspective trying to go to this end goal. But oh, sorry, I'm like moving the mic. But there's a point where your research is going to cross in the middle, and the information they have is going to help you, and the information you have is going to help them. So kind of just talking with them and see where you're going to go in the future, because even if you're not quite lined up yet, you might be in a couple months, couple years. That's all I had.
It is really all relationship building, right? And the common thing is we're all geeking out over research, essentially, right? And they have what they geek out over, I have what I geek out over, and we just bring that together. And that's kind of how it unfolds. Okay. I'm gonna go there and then we'll come back. You can do rock, paper, scissors, who goes first? Okay, so how do we recruit? And then I missed the middle part of who we get. Okay, gotcha. Okay, so some of you are doing recruiting. Do you want to talk about it, or?
I can take this one. So it depends on the study, I would say, and I'm not going to speak for anyone else on the panel, but for the recovery study, we're using various methods such as Craigslist and Facebook to try to incentivize people who are looking for help for AUDs to respond to our ad. And then we will reach out to them and ask them some questions, and then hopefully get them to come into our clinic and see if we can get them enrolled in the study. But again, that varies based on the study.
And also, like, if you're recruiting from something very general like Facebook, like most people have Facebook accounts or Instagram accounts, you know, so that does get like a pretty general, like pretty wide range of responses. But then from there, like let's say you're running your study and you're halfway through recruitment, you've like check your demographics and you see the breakdowns like 90% white people or something, but you want to make it more reflective of the demographic breakdown of Tampa, for example, which is not that. You can kind of like once you have your list of responses, you don't have to just like no one's requiring you to just go down the list. You know, you can always just like get asked for certain questions, you know, and then just like reach out to those people first if you want to like however you want to do it.
Targeted recruitment.
Yeah. So you can do that like as you're going through the study to like even out the numbers to get things more representative of whatever you're going for.
Yeah. And to answer your question about does the word alcohol sort of lead to a biased sample? Well, in some ways, yes, because that's what we're looking for. Right. So if we're looking to recruit people with an alcohol use disorder, we'll use the phrase like, have you ever been concerned about your drinking? Right. And so that's who we are targeting. So in that regard, yes, it is biased because our population of interest are those with alcohol use disorder. Now, certainly when you use things like social media, that's requiring technology. So it could be a little skewed more towards that. But I think almost everybody has smartphones nowadays. So I think it's less of a concern now than it was maybe 20 years ago. But there's always going to be some self-selection in any type of research because they're responding to an ad, right? And there's probably no good way to get around that because people who respond are going to be different than people who don't respond to some extent. But we try to account for that by looking at all the variables involved. So
I have one more thing to
yeah,
say.
I'm sorry, Gail.
So you're good. Can't see me. So also one thing to note is that a lot of the people who get to a point where they have an alcohol use disorder are most likely also surrounded by people who are kind of like reinforcing that. So they might have other people in their community who also consume alcohol to a point where they could be eligible, let's say, for a study we're looking for. So that also to some extent works as like a word of mouth to answer your like recruitment question. So a lot of people who come into the study, like sometimes they have partners who are also like using alcohol. Sometimes they have friends. So that also helps with recruiting. And if they know someone who's in the study who is like, that kind of helps reduce the stigma around it. And it's like, oh, that person recommended that study for me. So that also helps with some of that.
And then the other thing on that with that stigma portion, I think kind of more specific phrasing. So when we're recruiting, I really like to use the phrasing alcohol use disorder because it's going to be a bit more neutral and a lot less identifying than saying, do you struggle with alcoholism? Because I feel like saying that puts more of an identity on the individual instead of focusing on the treatment they're seeking.
Wow. Okay. Go ahead. Yeah. Yeah. I'm coming back. I promise. I haven't. Our lab doesn't necessarily, but I know a few colleagues in the field. Mike Frone was one that did some of the big epidemiological surveys of workplace substance use. And it was, I can't remember the number, so I'm not even going to pretend I know, but it was a lot higher than you would expect of people being intoxicated in the workplace, even in jobs that it's a hazard. So, but I don't know the numbers off the top of my head, but there are people that do it, IO psychologists that have looked at substance use in the workplace, yes, but not us. Okay, yeah. There and then I'm gonna come back here. Yes, I know. Yeah. Mhm. I'm assuming that's for me, right? So have we seen sort of trends in the people we're recruiting, essentially, is what you're asking, especially if we're tapping into the same area? Yes and no. I mean, substance abuse rates and alcohol use rates have remained relatively stable, just from that regard, although there has been a little bit of an uptick after COVID. Apparently, the beverage industry did really well. There's a lot of reports on that of how much they've made during this period of time. So the uptick in terms of some of the prevalence is going up there. I don't think I can answer that directly because I don't know if I've seen any like major changes like in terms of the samples we're recruiting. We might be seeing a little more marijuana use in our AED populations, with the sort of growing popularity acceptance of different uses for marijuana, right? So I think we are seeing maybe more of that. Does that kind of get at the question a little bit, or is there something specific you were curious about? Yeah. Yeah, I mean, typically when we recruit for like a treatment study, the average age is always around the same, mid to late 30s, early 40s. We've had good success in the past of getting a pretty racially and ethnically diverse sample. Currently, we're struggling a little with that, so we're going to do a little bit more targeted recruitment to try to get a more representative sample. So I don't know if that's a reflection in the recruitment methods. That could be, but it's too early to know exactly what's leading to that. So, I mean, yeah. Does that answer it? Okay. I got to keep it. We got a couple minutes left, so I'm gonna try to get a couple more in. I'm gonna, yeah, go ahead, and then I'm gonna come back over here. I saw some hands here too, didn't I? Okay. It can be dangerous for some people. Yes. So from an alcohol withdrawal perspective, safety concern. So there are validated structured interviews that you conduct with the individual, and you also look for the behavioral signs of alcohol withdrawal. So when they come into our study, they have to blow negative. They can't have any alcohol in their system, so we actually do a breathalyzer. So if it's somebody with severe withdrawal, you'll start seeing some of the shakes, and those are things you look for, and it's part of a structured interview that allows us to assess the level of dependency and the potential dangerousness if they just cease alcohol altogether without detoxing. Um, Usually we catch it earlier on. So if we've had individuals that we've had to refer out first and they go to like an inpatient for a detox. Okay, let me just go over here. I'm gonna try to get, yeah, real quick. Go. She's shutting me down. Sorry. Yeah. And well, we can hang around and answer questions afterwards. No, you're fine. No, it depends on the study. Yeah, so we wouldn't ethically be, if somebody has told us they're actively trying to quit, we could not enroll them in our study from an ethical standpoint, and it wouldn't be allowed from an IRB perspective. So we wouldn't introduce alcohol to somebody who is actively trying to quit. Now, we do have sometimes drinking as our outcome in our studies where, people have experience with alcohol, aren't looking to quit, and then we bring them in the lab, and then we, maybe measures the dependent variable. Remember that funny term, as how much they drink. So we'll give them drinks and see how much they drink, but they're not seeking treatment. So we wouldn't do that from an ethical standpoint. Correct.